Welcome to my introductory neck care video. I'm Dr. Chris Brown with the Specific Chiropractic Centers. And today I'm going to be going over a very basic way to take care of our neck and also our upper neck. This is going to involve one piece of equipment, which is going to be a ball, ideally a golf ball or a lacrosse ball or baseball. Tennis ball, maybe it's a little bit soft, but this is what it's going to require. When it comes to the neck, I'm not a big fan of taking it to max range of motion like that. I'd rather be kind of conservative with my neck and how I move it, just because I know how impactful it is. We don't really want to be taking our neck to end range. We definitely don't want to be tracking it ourselves. That's not good to do. And this is going to be a super basic way to take care of our neck. So the first one is going to be just yourself. You can either look in a mirror. What I want you to do is take your fingers and go just behind your ear and then go down to where that bone, where you feel the bone start to meet soft tissue, kind of fleshy, right behind your earlobe right there. That's called our mastoid process. I want you to go just a hair below and keep your fingers there, okay? Now what we're going to do is just moving only the area above my fingers, do a slight tilt. So see, the rest of my neck is staying neutral. We're just doing a super slight tilt of our head and neck. And what this is doing is this is isolating that first bone of the neck, first and second bone of the neck, and we're stretching and moving all of the little tiny muscles in the upper neck. That area is called our suboccipitals. There's about 4 to 5 on each side, and what we're doing is we're working those without engaging any of the big main strap neck muscles, scalenes, levator, trap, all of those. We're not recruiting those. We're just trying to move as subtly as we can, about 5 to 10 degrees, something super subtle. Great way to stretch the neck. You can also do tiny rotations too, where you're keeping your hands here and just subtly rotating the neck. We're just working those super tiny intrinsic upper neck muscles, not trying to engage or recruit anything else. Now, you can also do flex and extend. You're just trying to pivot around your fingers. So I'm not doing a big whoa or a big look down. They're just fingers on find the bone, behind your earlobe, drop just beneath it, and then just tiny nod, tiny extend, tiny nod, tiny extend. That's how I like to do any kind of neck care. I don't like doing big turns like this. If I'm gonna do any kind of big turns like that, that's where lacrosse ball is gonna come in, because we're gonna be doing some pin and stretch style stuff. So with this, you need a ball and a wall, where we are going to be actually placing the ball between myself and the wall, ideally on the spot that's tender or that's bugging you. Primarily it's gonna be on the trap, not really on the neck, but it's gonna be more so on this part of our body right here. You're gonna have the ball here, and we're going to move our head while using our body to pin the ball against the wall. So for example, we're gonna take that ball, pin it to my body right here, the ball is right here, and I'm gonna do some simple moves with my head. The first one is going to be taking my ear towards my shoulder, like this. I'm gonna stand up a little bit straighter. It's going to be taking my ear towards my shoulder, turning my nose towards my shoulder, and then taking my forehead towards my shoulder. That. Come back to center. Ear towards the shoulder, nose towards the shoulder, head towards the shoulder. Boom. And we're pinning that ball against my trap. And what we're doing with that is we're opening everything up. Boom. Just like that. There. We always do both sides. Always do both sides. pin. Take your ear towards your shoulder, nose towards your shoulder, forehead towards your shoulder. Oh, I need this too. Oof. All right. So ear towards your shoulder, nose towards your shoulder, forehead towards your shoulder. Keep going. Ear towards your shoulder, nose towards your shoulder, towards your shoulder. When it comes to these, typically I like doing about 2 rounds of each. So I'll go back and do the same thing on this side, there, come back, do the same thing on this side, turn, ear, turn, turn. And what we're doing with that is we're creating a maximal stretch of these bigger muscles of our neck. This is our strap muscles, scalenes, our levator scap, and also our upper trap. That's going to help open up the area from your ear all the way to your shoulder, because if you're like most people, that's an area that always gets super tight. Typically that's due to any kind of laxity or tension or misalignment of this upper neck, as that's where these muscles originate, and that can cause the entire muscle to start to compress, tighten down, which can lead to that chronic neck tightness, neck pain. So once again, I'll re-wrap through all these exercises. Take your fingers, go just below the bone by your earlobe. Head will move, fulcruming around the fingers, just working that upper part of the neck and those tiny intrinsic muscles. Then we're gonna take the ball, pin it on whatever part is tender in here, and then we go ear to shoulder, nose to shoulder, forehead to shoulder, really stretching out and opening up that back part of our neck and our upper shoulder. Neck hair can be basic. It is also tough if you're not getting regular chiropractic care, as chiropractic and nervous system health, really that's the fundamentals and the foundation of creating a really healthy physiologic human. So if you're not under care, please check it out. Check out the upper cervical clinical case reviews that I've done. Those are documenting some of the patients and their histories that they have, what they came in with, and how they responded with upper cervical care, and it's really humbling stories. So if you haven't clicked follow already on the subscribe button, please do so. That's on the homepage. And then there's a playlist called Upper Cervical Clinical Case Reviews. Those are some of my craziest stories that I've had in practice up to date. And it's really humbling going back and watching those. So thank you for tuning in. I hope that this helped. Please reach out if you have any questions. My email is drbrown@thespecific.com. And I look forward to meeting you in person, hopefully. I'm just here to make longevity simple. Thanks for tuning in.